So I'd like to maybe discuss with you briefly here how the FECA program is working to reduce injured employees' time away from work and return employees to work. Can you explain in some detail the program's goals? And
the gentleman's time has expired.
I'll submit that in writing. Thank you.
Thank you. I now recognize the gentleman from Indiana, Mr. Rokita.
Well, I thank the chairman and I thank the witnesses for your testimony today. Mr. Steinberg, could you answer the congressman's question?
I can, and I can proudly answer that. We have extensive focus on return to work. I think in years past, workers' compensation programs were typically seen as a wage loss replacement program. And yes, our program does provide that, and it's a hallmark of our program to have a very generous level. But we spend a significant amount of time focusing on return to work. We've put in place a disability management program where we have staff nurses that work with field nurses. We try to get to the claimant as early as we can to make sure that they get diagnosed, they get into early treatment, and they get into early rehabilitation. Those are some of the proposals that I talked about in my testimony to permit us to engage in vocational rehabilitation before the injury is identified as permanent in nature, which is typically 6 months. We believe that if we can begin vocational rehabilitation and put in place a rehabilitation return to work plan earlier in the process, we have a much higher probability of returning the individual to work. Our statistics are terrific. 85% of those individuals with serious injuries that are out of work for more than 45 days, 85% go back to work within 1 year, and 92% go back within 2 years. Of the approximately 120,000 cases we receive each year, only about 2,000 of them go on our periodic rolls at the end of the 2-year period. And I think to a large extent that's because of our interventions.
Thank you, Mr. Steinberg. I also witnessed the spirited exchange that Congressman Miller had with you. Do you have anything to add to that?
Well, again, I think it's important to point out that OWCP, the Department of Labor, we take terribly seriously our responsibility to protect injured workers. I think this is being, unfortunately, portrayed as an intent to harm federal employees, and that certainly is not the intent. What we have done is analysis of the rates that we have and the rates that the states have. We've also talked with OPM in terms of what retirement rates should be, and we believe that we have proposed a slight reduction in rates, not major changes, but a slight reduction in rates that provide a level of fairness and equity between the injured worker and the non-injured worker.
Okay, thank you, Mr. Steinberg. And Mr. Sherrill, am I pronouncing that right? Thank you. Quick question for you, maybe not so quick. Your testimony notes that in the prior report from 1998,
yes,
GAO analyzed the adequacy of the FECA benefits by comparing benefits to take-home pay at the time of injury.
Yes.
The current report compares benefits to take-home pay an employee would have had absent an injury.
That's right.
First, can you briefly elaborate on the different methodology used in each report? And then also, as we consider policies in this area, what do you think are the merits and drawbacks of each methodology?
The 1998 report basically answered the question of to what extent do the FECA benefits support the person in maintaining the standard of living they would have had at the point of injury. And so it factored in wage increases, sort of average wage increases for the federal workforce over time. That factored that into the analysis. The work that we've done here with improved methods, access to the additional data sources, factored in what would the person's missed career growth have been, because we matched them to a very closely matched counterpart. And so it really gave a sense of, how adequate are the FECA benefits with respect to what they would have otherwise received in terms of federal wages and salary.
So an improvement, this later methodology over the earlier one?
Yeah, because in the past the data often were not available to really get a sense of how people would really be affected and to assess the counterfactual in the absence of being injured, what would have been the case. But now we have better data, better methods to do that kind of analysis.
Thank you. And the last two witnesses, while I have some time, Dr. Seabury, anything to add along the lines of the questions that I asked in 30 seconds?
Yeah, 30 seconds. I just would like to confirm, I do think that the approach to using the matching approach is an improvement. I think that a distinction needs to be made between what's used to calculate benefits versus assessing the effect of a policy change on workers. And so I think to capture the actual effect of the policy change on workers, you need to consider the lost career growth, because that's a very real consequence of a workplace injury that should be factored in. And with return to work, I think the real challenge with return to work is there's an assumption that, or it's an unknown how much of the workers who are on long-term disability currently have the capacity to work but aren't choosing to because of financial incentives. And I think it's just not clear, there's not enough evidence to say how big a share that is. And so I think the biggest concern with some of the policy proposals is that the DOL proposals to get people back to work are great, including increased rehabilitation, but we don't know how that's going to affect the people who don't get back after those policy changes are implemented.
Apologies to Mr. Simon Dara. My time's expired.
I thank the gentleman.